Mama mzazi wa walemavu hawa ambaye ni mjane.
Mother of the victims, Nigejinjwa Amini, who is also a widow, says they were among 8 of her children and that the 5 children were born safe and normal, but paralyzed as they were growing. She noted that in addition to poverty facing her, the 5 disabled children also need health services for infections they get due to their vulnerable living conditions. She urged the government and Good Samaritans to help at least to get health services and also improvement of their residence.
I don't know if this problem was God's wish or where the omen comes from. In a family, it is usual to have a child born with a disability, but you find only 1 or 2. But for me, almost all of my children are disabled.
She noted that in addition to poverty facing her, the 5 disabled children also need health services for infections they get due to their vulnerable living conditions. She urged the government and Good Samaritans to help at least to get health services and also improvement of their residence.
I am poor and a widow. These children crawl even to the toilet where they can get infections, and unfortunately, they have no access to health services, nor have they ever received any medical examination since they were born. But it is only the Almighty God who looks after them.
One of the mother's child, Chedieli Amini, custodian of the disabled children, apart from thanking some Good Samaritans for their help, say they still face an uphill as assistance they got was not sustainable. We get minor donations and we thank for that, but to a large extent most of the assistance is not sustainable. Therefore, we still have a big problem, and whenever I approach government leaders, they say there is no money. Among them is the Dar es Salaam-based Legal and Human Rights Center LHRC, which has donated 500,000 shillings and urged other people to see the need for supporting this family. The donation was delivered by a representative of the center, Hussein Ningu. This family can get assistance if the society and firms see the need of their social responsibility in helping desperate people. It is a big problem as we're used to seeing a single person with disability in a family and not the whole as this one. We shall continue to help them, but we ask other people to emulate our example. Other supporters who have followed suit are Tanzania Revenue Authority TRA Kilimanjaro region, which has offered to rehabilitate the family's residence. And the offer TRA representative Elizabeth Minde also appealed to other members of the society, including corporates, to see the need to support this family.
First, I pay tribute to those who have made efforts to recognize the plight of these disadvantaged members of the society, whom we shall continue to support. But we also want other stakeholders to help them.
In his response, Same District Commissioner Herman Kapufi said after getting the information they have started to help the disabled children through the district council. The council through its health department has made arrangements of the disabled children providing health services to the family. After getting the information, we have taken measures to support them in collaboration with other stakeholders. We shall continue to support them, but we also ask more stakeholders to come up to help the family. Mother of the children, Nigejinjwa Aini, renewed her thanks to Good Samaritans who have been supporting them, but also urged others to see the need of helping them. Apart from getting treatment through Same District Council, to date the family is still dependent on Good Samaritans, as owner of the family is unable to do productive work because of spending most of our time to care for the disabled children.